MetaVision OR by iMDsoft allows us to focus our attention on the patient and their clinical care and relieves us of the mundane aspects of paper charting. And we know that specifically as a Level 1 trauma center, where we're commonly faced with emergency circumstances, patients brought directly into operating rooms from ambulances where we need to be giving life-saving care, moment to moment, focused on the patient at all times. We went with MVOR because our institution did have prior experience with iMDsoft as a vendor. In addition to that was an appreciation on our part that additional upfront work on customization and implementation would provide lasting satisfaction for us. And what MVOR really brings that's distinct from many other systems that are out there is that in addition to functioning to provide this automated record, to synthesize this clinical monitoring information, it also brings real-time clinical decision support, surveillance of ongoing activities in the operating room, and query functions which are really state-of-the-art compared to other AIM systems which are available. The adaptability is a key feature, and by that I mean adaptability both upfront and going forward. From the start, you want a product that you're able to customize. You want a system that feels as close to what the paper record that you're used in your institution felt like to interact with. It specifically benefits patients because it focuses the attention of their anesthesia caregivers on themselves or their loved ones much more than can be possible while that same caregiver is responsible for maintaining a paper record. Our experience has been consistent with the experience of others, and that is that once these systems are installed, they enhance staff satisfaction. It creates a certain wow factor. We have found that it's an important tool for recruitment and that people who come through and see our practice understand that our facility has the resources to provide this kind of support to them, that the system manifests our commitment to patient safety and accurate documentation, which impresses them, and that helps with our recruiting efforts. You will accumulate a practice experience which can and should be queried over time, both to support quality improvement efforts, but also to support research efforts. We knew that we were planning to go live with our anesthesia information management system, and because we knew that we were focusing on two key aspects of the surgical care improvement project, specifically administering the proper prophylactic antibiotic within 60 minutes of incision. And what we found in studying nearly 20,000 anesthetics is that improved compliance with these antibiotic care initiatives improved from 62% to well in excess of 92% when comparing the 6 months before implementation to the 6 months after. And more importantly, rather than just complying with something that we were asked to do, we showed that improved patient outcomes. Looking back to the efficiencies and accuracies that accrue in the billing and collection process from having an AIMS, in our practice meant that we were able to negotiate a lower fee for our billing and collection services, and that is totaling nearly $200,000 per year in reduced expenses to our practice from the billing and collection process. We appear to be at a tipping point, with 44% of academic anesthesia programs now committed, at least to those extents, to implementing a system, and I think that tipping point should serve as a signal to those departments who haven't yet made this commitment that now is the time.